Imagine waking up one morning, expecting a normal day, but instead feeling a strange tightness in your chest. You try to shake it off. Maybe it's just a cold, or the after effects of a restless night. You cough, clear your throat, but then you notice blood. This is the terrifying real story of Artyom Sidorkin, a 28-year-old man from Izhevsk, Russia, whose mysterious chest pain turned out to be something no doctor, no patient, could have predicted. Artyom was healthy. He didn't smoke, drank only occasionally, and led a modest, hard-working life. He worked as a driving instructor, guiding new drivers through the winding streets of his quiet city. But over the course of a few weeks, something inside him began to change. It started as a light cough, harmless, like dust in the air. He felt a bit tired, but he chalked it up to long work hours. But the cough didn't go away. It deepened. Then came the sharp, stabbing pain in his side. Breathing began to feel heavier. Deeper inhalations sent shocks through his chest. Then one morning, while brushing his teeth, he spit into the sink and saw blood. At that moment, Artyom froze. His mind raced. Was it bronchitis? Pneumonia? Or worse, lung cancer? Still, he hesitated. Like many of us, Artyom wasn't quick to see doctors. He hoped it would pass, but within days the symptoms worsened. He couldn't sleep lying down anymore. The pressure in his lungs was unbearable. His chest felt tight, as though something was pressing outward from inside. The pain was constant, deep, and pulsing. Finally, he visited a local clinic, and doctors immediately ordered an X-ray. What they saw stunned them. A dark mass, clearly visible, lodged deep in his lung. Its shape was irregular, its size concerning. Based on the scans, they feared it was a tumor, likely cancer. Artyom's world turned upside down. He was young, healthy. This couldn't be happening. The doctors scheduled a biopsy, and Artyom prepared for the worst. He called his parents. He asked for time off work. He didn't tell many people. He didn't want the pity, the long stares, the endless questions. He just needed answers, and fast. On the morning of his surgery, Artyom lay on the operating table filled with dread. The cold, sterile lights above blurred in his teary eyes. His thoughts spiraled. What if they removed part of his lung? What if it had spread? What if this was it? But when surgeons made the incision and reached the mass, what they found left them speechless. It wasn't a tumor. It was green. Nestled inside Artyom's lung was a 5-centimeter-tall fir tree sapling, a living, breathing, sprouting tree. Its tiny needles were poking into his lung tissue, causing pain, inflammation, and the bloody cough that had brought him there. The surgeons stared at it in disbelief. They'd never seen anything like it. One of them even asked, "Are we sure this isn't a hallucination?" They removed the sapling with care and preserved it for study. The operating room, for a brief moment, buzzed not with tension, but awe. Medical experts believe that Artyom must have inhaled a seed, likely while outdoors in the forest, or even doing yard work. But rather than being expelled, the seed somehow embedded itself into the soft tissue of his lung, and incredibly, it germinated. With the right combination of warmth, moisture, and oxygen, that tiny seed had found fertile ground in the most unlikely of places, a human body. After surgery, the doctors told Artyom the good news. It wasn't cancer. and he would make a full recovery. The sapling was gone, his lung would heal, and the nightmare was over. But the story was just beginning. News outlets picked up the tale quickly. "Tree grows in man's lung," read headlines across Russia and beyond. The bizarre but true case became a medical mystery studied in hospitals and universities worldwide. Scientists marveled at the resilience of nature, how life finds a way in even the most inhospitable environments. And Artyom, he became the man with the tree, a living reminder of just how strange and unpredictable our bodies can be. But more importantly, his story became a wake-up call. You see, Artyom didn't feel sick, not at first. He had no reason to think something was wrong, but the signs were there. Fatigue, shortness of breath, chest pain, blood in the cough. These were not just symptoms, they were warnings. Warnings he almost ignored. How many of us do the same? How often do we dismiss our body's cries for help? How often do we let fear or pride keep us from getting answers? Artyom's story may be rare, but the lesson it leaves behind is universal. Listen to your body. You never know what might be growing inside you, literally or metaphorically. And sometimes, just sometimes, it's not a tumor. It's a tree. If you found this story fascinating, make sure to hit like and subscribe. And tell us in the comments, what's the most shocking medical case you've ever heard of?